Okay, hi Miss Isabel, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and right now we've just got a shaver coming in. You're laying on your side, so your arm is actually pointing up in the air. And right here from the onset or outset, we can see that you've got some wear and tear changes on the humeral head up above because you've got some cartilage thinning. That's what the shaver is kind of touching right there. Just make sure there's nothing loose. It's a little bit hard to see the rotator cuff tear because some of this tissue's in our way, but we're going to debride that a little bit. And now we'll get a good look at the biceps tendon. You can see it's already got a partial tear there, so we'll do what we call a soft tissue biceps tenodesis. And the way that we pass the suture through that's with a spinal needle and a free shuttle relay. And so we'll show you that in just a minute. Before we do that, or while they're getting that ready to go, we'll look up here. This is the rotator cuff tear at the top of the screen. And we will just use our shaver to clean off the rotator cuff footprint a little bit from this articular side. But as you look up towards the top, you can see where that tear extends all the way out. And we know from your imaging that it's a full thickness tear. So it's not very retracted, but that's a good thing, not a bad thing. Okay, and so the next thing we'd like to do here is look towards the back of the shoulder. And here we get a pretty good idea of how much arthritis you've got. We can look at the humeral head here and see that you've got some significant areas of thinning of the cartilage. As we look down the front of the shoulder, this anatomy actually looks okay for the moment. So we're going to go ahead and take a spinal needle and pass that through the biceps tendon here in just a minute. Okay, so here's our spinal needle. And you can kind of get an idea of what we're trying to do. We're going to pass it right through the middle of the biceps tendon just like that. Hold that or give that back to her. I need a grasper. And then the shuttle relay. And so now we're going to take... okay, so here you can see the black wire there. That's the shuttle relay coming through. We'll retrieve it here, back the needle out. We'll take a free suture and load it. High five. And so, in just a second, if you keep watching there, and then on this thing, whenever you get a chance, keep two hands, right hand on that, so that way you can use that to follow me. So, we'll go ahead and take our high-fi suture. We'll pull back on it. There you can see it going through. And now we're going to repeat the process one more time, so I will take, let me adjust you. I will take the spinal needle. And we'll come through at a slightly different angle in just a second here. Get a little bit more to the right on the screen. Just like that. And so now we'll hold that, just like that. We'll take our relay and our grasper. Now we've got a couple little tricks here we wanted to show you. So we'll bring a little bit more, keep pushing in, bring a little bit more of the relay in. We'll back the needle out. Careful there. And now the trick is that we're going to sneak behind the biceps to retrieve the relay. So see, now we're behind the biceps. And we'll get the relay here. Hold the camera right there. And now we'll pull that through and load it. Okay, so we've released the biceps tendon, so it's no longer inside the joint. We're going to be reattaching it a little bit later. And that's what makes it what we call a tenodesis. It means we're going to reattach the biceps. And right now we're just working on the superior labral area here to make sure there's nothing remaining that could cause problems. Now we're just working where the rotator cuff is torn right now at the top of the screen. Okay, so we're up in the subacromial space. We've changed positions with your shoulder. We're looking from the top down onto the tear now. There's the hole in the tendon that you can see there. That hole is going down into the joint. So posterior is to the left, anterior is to the right. And with this burr, we're just going to start and smooth off a little bit of this bone that makes up the roof of the shoulder. This bone's called the acromion. So we take this basically flat instrument and just slowly advance forward. You can see this little spike hanging down, and that's really what I want to remove, just like that. We just don't want anything that could potentially rub on the top of the rotator cuff and have a negative impact on our repair. So just that quickly, that already looks better. See, that little area that was hanging down, there's a little bit of bone right there. But now that's nice and smooth. So we don't have to take off a lot of bone, but I think that's important. Our anterior cannula is right here. And now we'll go ahead and get to work on cleaning up the edges of the tear, which once again, right here. Those sutures you see, put the shaver back on, please. Those sutures you see on the right are from your biceps tendon, so we won't deal with those until the very end. But that also is how we know that that's the anterior portion of the shoulder, because the biceps tendon's towards the front. Okay, so we've cleaned up the tear. We can see it extends back posterior more than you would think, which is not uncommon at all in these situations. We're going to try and repair the full thickness of that. Just judging from the markings on the back of this shaver, it's there's 1 centimeter, there's 2. It's a 3 centimeter and some change tear at the articular margin. Even way out here laterally, it's still 2 centimeters. So we're looking at a pretty good sized tear here. We're going to use our Rotium implant to assist in the repair, but the next step for me is to go ahead and take a spinal needle and kind of plan where we're going to, you can relax on these, plan where we're going to place our suture anchors. This is almost certainly going to be 2 suture anchors, but we'll make that decision as we go. So here's the spinal needle coming in. You can see that tear goes all the way back here. So we're going to place our first implant. If you hold the camera right here, our first implant ends up getting placed about, our first anchor ends up getting placed about like that. That looks like a pretty good spot. So we'll go off in the video and show you some more in a little bit. Okay, so we've got the first anchor in. It's a triple loaded anchor. I'm just trying to get to a point where I can show you. The sutures are a little hard to see because I put the anchor, I put the anchor posteriorly on purpose because, again, we're planning on placing 2 of these. So if I push the cuff out of the way, you can see the placement there. See how that's posterior, almost tucked underneath this posterior flap. But that's perfect. That's exactly what I want that to do. And we will now get to work. Okay, so we've got the Rotium implant down. You can see it's just this. This is it right here. Underneath that is the greater tuberosity. See, right there? And we're just laying it right down on top. We've kind of custom fit it so it sits flat. It's going to fit nicely between the rotator cuff and the bone. So I'm very happy with the way that looks. And now the next thing that I have to do is we've got to start passing these sutures one at a time to repair the rotator cuff tendon over the implant. So now I've got my crochet hook coming in from the front of the shoulder, which is the right side of the screen. And we're going to lift up and take all these sutures out here so we can have a good look at how we're going to do this repair. So it looks to me like if I do it right, maybe the black and white suture right here would be the first one that I want. And so we'll retrieve that out here. We'll make sure we don't unload the anchor. That looks good. And now we're going to pass that underneath here. Okay, so now we've got our suture hook coming in on the left side of the screen. This is what it looks like, loaded with a super shuttle, which is that wire that you just saw sneaking through. And so we look at the tear, and we know we want to bring this through basically just like that. Hold the camera now, a little tight. I'm going to take a grasper in here. We're going to lift up on the tendon, and I want to make sure we get all the way back here. So we'll get this accomplished and show you some more in a minute. Okay, so here you can see the pass, the very first one. See how I'm way in the back here, and now we're going to feed that relay underneath, and that looks really good. Okay, so here you can see that suture going underneath there. That looks good, and it's coming out right back here. So now we're going to take the crochet hook. You can get rid of the probe if you want, and we're going to get the partner suture here, which we know is the black and white one. So I'm going to look at these, make sure I'm getting it in the right direction. That looks pretty good there. And so now we're going to tie that first knot because that'll help us plan the rest of the repair. Okay, hold the camera here. Not pusher. Okay, let's cut it. I got you here. Okay, recording in a second here. Okay, so now we're getting ready to tie another stitch. There's the first one tied right there. And now we've got this blue and white one ready to go.